Welcome to Visions for Health. I'm Wendie Trubow, co-founder and chief operating officer at Visions Healthcare. I have Alaine Amaral, registered yoga therapist and Bachelor of Fine Arts today with me. Alaine, welcome.
Thank you.
Thank you for coming on the show.
Thanks for having me.
So I just learned about you that you have a degree in sculpture.
I do.
How did you go from sculpture to yoga? Although you could argue you're sculpturing people.
Yeah, I've always had the three-dimensional sense, so I do tend to think of things from the inside out, so I think that has helped some. But it certainly wasn't a linear path. I graduated with my degree, and I was working with children for a lot of years at after-school programs, nannying, things like that, teaching art lessons. And when I was about 30, I injured my back. And I had practiced some yoga and more meditation before, but I hadn't really had a regular practice. I'm a little lazy by nature. So I hurt my back. And
low key, actually.
Well, I've never been a big, I don't go out and run every day. I'm not, I look like I'm quite fit, and I am now, but I've never had to really work at it. Yeah. So when I hurt my back, it just it wasn't getting better. It wasn't healing. In fact, it was getting worse and worse, and the doctors were having a very hard time finding out what exactly was going on beyond the initial injury.
What did you try before you got more into yoga?
Well, after my injury, you mean?
Mm-hmm.
Yeah, so I saw, a lot of doctors, and I was taking muscle relaxers. I really don't like taking prescription drugs, but I was getting pretty desperate, so I was taking them and doing physical therapy and starting to have some body work done and finding things that helped a little bit, but nothing that was really helping me to understand why I was in so much pain all the time. I had a 2-year-old, and I was still trying to work, and it was really difficult, and I was having a hard time just functioning in my everyday life. So finally, during a regular physical, I had some blood work done, and it came back looking pretty abnormal, and it looked as though I may have an autoimmune disease. So I was sent to a rheumatologist.
For seeking you shall find.
Yes,
right?
Yeah, exactly. And it turned out that I didn't have an autoimmune disease, that my blood reacted with the medium on the slide. I guess they use rat liver cells or something on the slides.
I didn't know that.
I didn't know that either. And so it looked as though I was having some sort of an autoimmune reaction, when actually it wasn't. But it did bring me to the place, to sort of the right doctor who could help me, and he examined me, and I was in tears, as I was a lot of the time, because I was just really feeling desperate. This was 3 years after the initial injury, and he diagnosed me with fibromyalgia. And so from that point, I just started looking at things differently. I had started doing some yoga and was getting a little bit of relief from it. He recommended that I do Jon Kabat-Zinn's Mindfulness-Based stress reduction, and that's where I really, really learned to meditate and really started getting some relief, not only from some of my physical symptoms, but reducing my stress and being able to just think about being, I don't even want to say being ill, but really not being well. Really not being well, and being able to think about it in a different way, and being able to deal with it, and just be able to live my life and not be miserable all the time. So that was a big turning point for me.
I think illness has us think about things in a different way.
Yeah.
And then the question is, how do we have our illness and not be our illness?
Right, right.
So you sound like you were really exploring that.
Yes. Yeah.
Do you remember the first yoga class you took?
Well, the very first yoga class I took was when I was 17, and I was in high school, and my senior year we got some choices for what we wanted to take for gym class, and it was in the weight room off of the big noisy gym in my high school, and we were doing some postures, hatha yoga and headstands and this and that, and then just doing that really lovely layout that you do at the end of yoga class, where you're just lying on your back and the lights are dimmed, and it's very peaceful and relaxing. And I thought, this is great. I like yoga.
Did you start yoga then, or was there then a pause?
Well, I practiced a little bit at home. I think at that time I didn't know of any yoga classes. You know, this was in the mid-'80s.
Yeah.
And I don't remember there being yoga classes around. I think if there were, I probably would have started going. So I practiced a little bit at home, but I always just remembered that feeling of, wow, this is really nice. And you know, when you do yoga and you get that chance to relax afterwards, it's a really deep relaxation because you've made changes in your body. Not only, you know, people think we're just stretching muscles, but you've balanced your nervous system, you've stimulated the glandular system in particular ways. You just feel more balanced, and when you do that layout at the end, your body is absorbing those changes and you really feel what it feels like to relax.
So you liked it?
So I liked that, yeah. Then I dabbled a little bit in meditation during college, but it wasn't until that experience of really having to stop and really having to look at what was happening in my body and really being forced to make very serious changes in my life that I really started practicing in a more serious way.
How did it impact your fibromyalgia?
Well, when I first started going to some yoga classes after the initial injury, and nothing really seemed to be helping a lot, I kind of went to a yoga class as a last resort, you know, and I find this a lot with my clients is they've sort of tried everything else, and it's like, well, if I can't get any real help, if nobody can give me a pill or give me, you know, and we all want that. We want the quick fix. We're busy. Nobody wants to have to work at it if we don't have to. So as a last resort, I thought, well, you know, I did that yoga and I liked it. I'm going to try this. So I went to a Hatha yoga class, which is, Hatha is more postures. You get into a certain posture and you hold it for a length of time, and you're breathing and you're trying to be present in your body. But it was difficult. I was already pretty deconditioned at that point. I didn't have a lot of strength left. And it was really hard for me to hold those postures, and also really, really stiff, as a lot of people with fibromyalgia are.
Yeah.
And I walked out sometimes feeling worse than when I walked in, and I thought, ugh, this isn't the way it's supposed to be. You know, I still liked the layout, I liked pieces of it, but I wasn't really connecting with the practice. And then I was living in Millis, Massachusetts at the time, and we have an ashram. And I had been living there for years and wasn't really fully aware of this ashram. I had seen people around, you know, that lived there. They're very distinctive. They wear turbans and they were all white. But I didn't know much about it. And then in our town recreation department catalog, I saw that there were some yoga classes there, and there was a class for women, and it was supposed to be gentle. And I went and talked with the instructor, and a friend of mine went with me. And I went every week, and I started getting little windows of relief from the pain that I would feel better for a few minutes.
What kind of yoga was this?
So this was Kundalini yoga.
Okay.
And this was the first teacher training I did, so kind of my base is in Kundalini yoga. It's less posture-based, so I didn't have that holding of postures that was really difficult for me. It's a little bit more of a rhythmic movement, a lot of breath work, a lot of meditation. And for me, it moved things in my body in a way that didn't require a lot of strength from my physical body. And in moving the energy, I started to get some relief and started to heal. And those periods where I felt better got longer and longer. And finally, I decided to do my teacher training in that modality.
So how many years ago was that?
So that was, let's see, I did my teacher training in 2003, so that was 10 years ago.
So congratulations.
Thank you.
Your 10-year anniversary.
10-year anniversary.
So it made a tremendous difference.
It did. It made a huge difference. And the teacher training was really challenging. You know, when I first started going to the Kundalini yoga classes, I was really weak. I couldn't sit up on the floor for any length of time. I had to sit against a wall with my back against a wall. So when I see people now through my practice that have pain and that really are having a hard time, I know where they're coming from, and I'm able to make those adjustments so that we can find a practice that really works for them, that they're able to do and able to maintain at home.
I think it helps that you've lived it.
Yeah.
You're not in theory, you're in reality.
That's right, yeah.
So you can say, you know, I've been there.
Right, right. And I'm still there. I mean, I still, you know, it's not like I did my teacher training, I went through my practice, and I'm done. You know, I still have fibromyalgia, and if I don't take care of myself, it comes back. So I really have to, you know, toe the line, and I have to walk the walk.
I think that makes a huge difference, but also because it sounds like your environment spoke incredibly loudly to you, and to support you in getting on a path for health, to stay there, to continue doing what works for you.
Right, right.
You know, I always say to my patients, there's no dieting.
Right.
There is no dieting. There is only a lifestyle change.
Right.
And it sounds like this falls in that realm, that there is no temporary fix for something.
That's right.
This is a lifestyle change. So your life includes a practice of yoga because you feel good.
Right. Absolutely, yeah. Yep, yoga, meditation all the time, even days that I don't do any physical yoga, I always do breath work, I always do meditation. Changes in my diet were really helpful, and just having an overall awareness of, you know, the things that are really stressful in your life. What can you do? You know, what can you do to lessen those things so that you're not kind of filling up that rain barrel to the overflowing point?
Are you still teaching art?
Not so much, but my husband and I own a business. He is a blacksmith, and so I'm involved in that. So I do a little bit of design work, and I've been doing the office work for years and years, and I've handed that off to someone else now. But I still kind of have my hand in it, and I still work with children through yoga.
Okay. Yeah. And you went on to have a second pregnancy after your diagnosis, after your pain. How was your pregnancy, given that you had had this injury? Was it fine, or?
My second pregnancy, I didn't have the diagnosis yet when I got pregnant. I was waiting to feel better to get pregnant, and at some point I kind of thought, I don't know how long I can wait. I'm not sure how this is going to look. So we have 4 years between our two girls, and the pregnancy, it was okay. It was hard toward the end. I tend to get really big when I'm pregnant, believe it or not. So it was hard on my back toward the end, but I actually found like the increase in hormones maybe lessened some of my pain. Yeah. So it was a different pregnancy, and my two girls are very different as well. So I think that there's some reflection there as well.
I think every kid has to be different.
Absolutely.
Talked about your dietary changes. How did that play a role in your increasing health?
Yeah, so at a certain point after I started teaching yoga, I wasn't a yoga therapist yet, but I was teaching yoga classes. I was teaching in Natick. I just started teaching a class, and this lovely woman came to my class, and I was getting over a cold, and I was really, really stuffed up, like teaching people how to breathe, and could not get any breath through my nose at all. And this was kind of a typical thing for me. I would get a cold and it would just hold on and hold on and hold on. I had a lot of seasonal allergies. I would get bronchitis every fall. And this woman came into class, and she came up afterwards, and she said, "Oh, that was a great yoga class. Thank you so much. I think I can help you with that sinus problem. I'm an acupuncturist." And I said, "Oh, I don't think so. I don't like needles." And she was one of several people who had said to me in the last couple months, like, "You should try acupuncture. You should try acupuncture. You know, the universe keeps poking you. You should try acupuncture." So finally I said, okay, I can't be such a baby about these needles. I just need to go and try it. And I found that that's a modality that helps me a lot, and I still go at least once a month. I have acupuncture. It just helps me overall to balance. Yep. So she started treating me for my sinuses, and she said, "You know, how much dairy do you eat?" I said, "Oh, I love dairy. I love..."
My favorite food.
I'm the dairy queen. I love dairy, you know, especially ice cream. I eat a lot of sugar. My one weakness, but in terms of my diet, sugar is my big downfall. She said, "You know, you should really consider cutting back on dairy and see how you feel. And sure enough, I cut dairy out, and it was like the sinuses went away, the seasonal allergies went away. I haven't had bronchitis in 10 years. A really amazing change from just that one thing.
Let's talk about this for a minute, because most people, when you say to them, you should really try to give up your favorite food, they say to you, no thank you, in slightly less courteous terms.
Right, right.
So what was that moment? Because that's not a typical response to say, oh, okay, I'll give up dairy, my favorite food.
Right, right. Maybe it wasn't that quick. So,
so there's a process there.
There's a process, yeah. And it is very hard. We're very attached to what we eat. You know, we really, food is, it's pleasurable, and we like it, and we have, all these attachments to what our moms fed us, and what your grandmother made, and your dad's family, and, culture and identity. And, but I think it's important to just be able to step back and say, I can do this for 2 weeks or 3 weeks and just see what happens. If you don't feel any change, go ahead and eat your dairy.
So it was temporary. You said, I'll try it and see how I feel.
I'll try it. It's not forever. I'll see what happens. Okay. And I really, really felt a difference. And so it's not like I don't have any dairy at all in my diet now, but it's sporadic when I have it. And I know if I have pizza one night, I'm not going to have I'm not going to have something with dairy the next day. So I think once you take something out and you see its effect, you can learn, well, how much of it is too much for me?
Where's your line?
Yeah, where's your line? And seasonally too, if it's very hot and humid, the acupuncturist will say you have a lot of damp in your body. So things like humidity, then you have to be careful. Then you're not going to have that. Whatever it is, that piece of cheese or that ice cream. And I still have ice cream for a treat once in a while, but I'm not going to eat it every day.
My kids don't understand. It's the one food I just don't like.
Really?
I don't like it.
Yeah. Oh,
so
I love it. Yeah.
It's not my Achilles heel. I have others.
Yeah.
So, did you find that it made any difference in your fibromyalgia?
Definitely, definitely. If I get on a kick where I'm, starting to eat dairy, my joints get achy. And that tends to be a pretty specific correlation with me. So with the fibromyalgia, there can be pain in the muscles, there can be pain in the joints. Sometimes it feels more like nerve pain on the surface, like the skin. And for me, the dairy, it brings the joint pain.
Got it.
Yeah.
Okay, well, I think avoidance of pain is a huge motivator.
It certainly is. Yeah, it's a huge motivator.
All right. So talk to me about the difference between a yoga teacher and a yoga therapist, because you're a registered yoga therapist.
Yes.
What does that mean?
Okay, so so yoga therapy it's kind of an up-and-coming field, and it's sort of the bridge between healthcare and the yoga world. Okay, so we're taking traditional yoga practices and we're modifying them to fit the individual. So normally, and we also have more specialized training than a straight yoga teacher. So my first training in the Kundalini yoga wasn't specifically yoga therapy. And there's a lot of healing kind of built into Kundalini yoga, but it isn't specifically used for therapeutic purposes. It's more for people that are healthy. And then the further training that I did was in integrative yoga therapy, and that was more geared toward working with specific populations. So whether it's people that may be going through cancer treatments or have already recovered from cancer, chronic pain like fibromyalgia, injuries, illnesses, and it can just be major life transitions, going through grief, things like that. But one of the main differences is when you walk into a yoga class, the teacher may or may not have the skills and the wherewithal to be able to manage what you have going on. So you can certainly walk up to the teacher and say, gee, I've had a hip replacement, da-da-da. They may or may not know what to do with that. Some do. But there may be 50 people in the class, so how much are they going to be able to really give you the specific modifications that you need? And if you don't have any experience in yoga or a lot of movement in your body, you may not be able to know what you need to modify.
And how to keep yourself safe.
And how to keep yourself safe. And a lot of people, will walk into a yoga class and it's not a good experience because they're either hurting themselves or they just feel really unsure or they feel like they don't belong. So yoga therapy is a nice way to either work one-on-one with a person or work in a small group. And I really get to know them first. So I do an intake with every student. I go through their medical history. I get an idea of who they are emotionally. Are you more prone to depression or anxiety? What brings these things on? What's your stress level? What do you do for reducing stress? Do you have a practice to do that? What are your spiritual beliefs, if any? Are you a person that tends to see the individual trees or the forest? You know, and that's kind of the five areas that I look at. So it correlates very closely with the Visions model of the 5 areas of health. From the yoga therapy standpoint, it's we call it the 5 koshas, and kosha means sheath or layer. So it's the physical body, the emotional body, the energy body, the wisdom body, so that's the forest and the trees kind of a thing, the big picture,
Yep.
and the bliss body, which is your feeling of being connected with a higher power. And so those are the things that I'm looking at when I do an intake with someone, and then I design a yoga program just for them. And it will include breath work, it will include some traditional yoga practices, whether they're posture-based or they're more movement of the energy in the body. So it can be really gentle or it can be more vigorous. Learning how to relax for yourself. So when I'm not there guiding you through a relaxation, you can learn how to do it yourself. And some form of meditation that works for that person, because there are a lot of different styles. And I have a background in a lot of varied styles. So I always say, you know, don't think you can't meditate. There is something that will work for you. You have to work at it.
Just sit
still.
still.
Not everybody can sit still and just clear their mind. In fact, I think almost nobody can. It's something you have to learn.
Yeah. I've never been able to clear my mind.
Yeah,
I just try to sit still.
Just sit still.
And breathe.
Yeah, so there's breathing that you can do. There's chanting, either aloud or silently. There are visualizations you can do. There's such a wide range, and I really like to encourage people, if you think that you don't like yoga or you don't like meditation, try a different style, because there's a style out there for everyone, and I think it can really benefit most people.
So can people go from an individual class with you into a smaller class?
Absolutely.
Of multiple people?
Yeah,
because you watch their needs?
Yeah, so if that's a goal that you have, that you'd really like to be able to just walk into that, you know, regular class in your local yoga studio, but you're just not sure, I can do a couple sessions with you and say, okay, here's what's going on in your back from what you've told me, and we've done our evaluation, and we've learned which exercises help you and which ones are difficult. So when you're in class, here's what you need to avoid. Here's what you do to modify. Here's what you don't do at all, and you just sit and breathe and visualize that you're doing that exercise, because you still get benefits from that. There's a lot of value in practicing with a group, and it's really nice for people to be able to do that and feel like they have that community. So sometimes that is a goal that people have. I want to be able to go to a regular class. I have some people that just keep coming back for individual sessions. Some people that will do my small group sessions and then transfer into more of a regular yoga class. So a wide range of needs.
This is extremely cool. And you work both at Visions Healthcare in the Dedham office, and you have an office in your home or near your home, a studio?
I have a studio in my home. Yep, I work with a few people out of my home, and I've dropped some of my other classes that I was teaching in local studios. I still do a lot of children's classes, really little, like preschool mostly, which is a lot of fun. Yeah, and I do that in local preschools and local yoga studios as well.
Has it been an easy, difficult, or moderate transition to go from working with your husband and doing the administrative work to not doing any of that? Was the transition easy for you, not easy?
It's been, you know, a little challenging, but Administration is not something I really enjoy. My parents are both bankers, so I always say, you know, thank God I've got the math gene and the organization gene somewhere in the back of my mind, even though I was, you know, an art student. I can do those things, I just don't particularly enjoy it. I like the marketing piece, I like the creative piece. I don't like the bookkeeping piece. And I did it for 16 years, and I was really happy to say, I've got this great job at Visions now, and I'm going to just start putting more and more of my energy there and less into doing the bookkeeping, which I really do not enjoy, and just kind of put it out there to the universe, like, bring me the right person to do this for me. And in she walked.
And your husband was fine?
He kind of, it took him a little bit to wrap his mind around it, but he's, you know, he's got this person now who's there at the shop with him and with the other people that work there, whereas I always worked from home because, you know, I could work with my children there. And it's working out well. So it's definitely a, you know, a process and a transition, but I kind of think everything's that way. So you just have to kind of go with it.
It sounds great.
Yeah, it's great.
We are coming towards the end of our time.
Okay.
In this show.
Yep.
Not the end of our time. Is there anything that you would want to make sure people knew about yoga therapy or about your practice?
Mm-hmm. Yeah. I'd just like people to know that it's probably more gentle than you can imagine, but that it can have a very deep effect on your well-being. And, you know, we all get to a point where we need to make these big changes, and it can be really hard. And having a practice that is using your body as well as your mind, the breath, tying all these things in is what really allows you to make those deep changes and not just kind of superficial that's going to fall away and you're not going to be able to, you know, continue. It supports you in making whatever changes, whether it's dietary changes. You know, you need to just take better care of yourself, be more present for your family. It brings a different awareness to your life that you're able to make these shifts in a different way. And so I would just encourage people to look further into it if they're interested and they think that's something that may help them.
Is this something people can use flexible spending account dollars for, or any healthcare dollars? Do you have any idea? And I just have to warn you, we have very limited time.
Yeah, right now there's no compensation through health insurance. I think it's moving in that direction. We've seen it with acupuncture, with chiropractic. I think when people go to health clubs, sometimes their yoga classes are covered.
Part of the package.
Yeah, so I think it's going to move in that direction, but right now it's out of pocket.
Got it.
Yeah.
Alaine, thank you so much for being here at the Visions for Health show. It's really been awesome to find out more about your practice and more about how you do it and who's appropriate. Again, I'm with Alaine at Visions for Health, and it's been a pleasure to have Alaine Amaral, registered yoga therapist and Bachelor of Fine Arts on the show. Thank you so much for being here.
Thank you for having me.